Let's start with fever, something I'm sure everyone listening has experienced at some point.
Ah, yeah, the chills, the aches, you all know the feeling.
But it's more than just feeling hot, isn't it?
Right, you can't just say any high temperature is a fever. How you take your temperature really matters.
Really? You mean like oral versus,
Exactly. Oral, rectal, under the arm, they all have different thresholds for what's considered a fever.
That's interesting. I never realized that. But why is it so important to know if you truly have a fever?
Well, it helps doctors get to the bottom of what's going on. A fever is like a warning signal, right? Something's up.
A sign that something's going on in your body. Makes sense.
It could be an infection, sure, but also inflammation, a reaction to some medication you're taking.
Or even something more serious, like the sources mentioned, is there's a surprisingly long list of possible causes.
It really is like detective work. Doctors have to ask a lot of questions to figure out what's causing the fever.
Yeah, like when did it start? How high does it get? Things like that, right?
Exactly. And whether it goes away with medication, every detail helps narrow things down.
Speaking of details, the sources mention these things called systemic symptoms.
Oh, right. Those can be really important,
They're basically symptoms that might seem totally unrelated to the fever,
but can actually give a huge clue about the cause.
like sudden weight loss, for example, or a rash.
Or even swollen lymph nodes, things like that. It's all about putting the pieces together.
One of the sources actually has this really cool chart. It connects symptoms to potential conditions.
Like a cheat sheet for medical detectives.
Exactly. For instance, cough and congestion usually point to something respiratory.
Right. But sometimes, even with those clues, doctors need to do some tests to get a better picture.
Yeah, like blood tests, urine tests, the usual suspects, I guess.
Exactly. Those can help identify infections, inflammation, things like that.
And if those don't give a clear answer, there are more specialized tests, right?
Definitely. Like if they suspect strep throat, they might do a throat swab.
Or even a spinal tap if meningitis is a possibility. Wow.
Exactly. And remember, the goal is to treat the underlying cause of the fever.
Not just to bring the temperature down.
Exactly. Don't just mask the symptoms. Listen to what your body is trying to tell you.